Okay, we're live. Good morning. Thank you for joining us today. This is the Rock County Public Health Department media briefing for Thursday, November 11th. This briefing is being streamed live on the Rock County Public Health Department's Facebook page. The recording will be available on our Facebook page and will be uploaded to our YouTube page once the briefing ends. I am Seth Lonkar, Administrative Services Supervisor, and joining me today is Nick Zupan, Epidemiologist, Michael Niles, Public Health Strategist, and Katrina Harwood, Health Officer and Health Department Director. We will be hearing some COVID-19 updates from our panelists first, and then we will open it up to questions from the media. I will now turn it over to Nick for some data updates.
All right, thanks, Seth. So in terms of our total cases over the course of the pandemic, 20,475 residents have tested positive. And this is reflecting some increase in COVID case activity. So over the last week, we're averaging about 64 new cases per day being reported to the health department. That puts us at about 800 active cases right now out in Rock County. And there have been 221 deaths due to COVID-19. We're not seeing the same level of increase in our hospitalized cases right now. So most recently, we've had 20 patients in the hospital getting care for COVID-19. Sometimes the hospitalized patient data does lag in terms of the increases and what's reflected in the case activity. So it's possible that in the next couple of weeks here, we could see some increases in our hospitalized patient numbers. In terms of our vaccination levels, almost 58% of the Rock County population has gotten at least one dose of the COVID-19 vaccine, and nearly 55% have completed the vaccine series. So that's all the data that I have for this morning.
Great, thank you, Nick. Now we will go to Michael, who will be talking about authorized use of the Pfizer vaccine for ages 5 to 11 years old.
Thanks, Seth. So like Seth just said, we're going to be talking about the recent emergency use authorization, or EUA, of the Pfizer vaccine for children ages 5 to 11. So the FDA approved the EUA for the Pfizer vaccine on October 29th. A dose of the Pfizer COVID-19 vaccine for this age group contains 1/3 the amount of active ingredient compared to the adult dose. Similar to the process for adults, it's recommended that children receive a second Pfizer dose 21 days or more after their first dose. The Pfizer EUA for kids ages 5 to 11 came after data was presented demonstrating that the vaccine is safe and 90.7% effective in preventing COVID-19 infections in this age group. The vaccine also effectively neutralizes the Delta variant, which is significant given the spread of that very contagious variant. The Rock County Public Health Department strongly supports the FDA's approval of the vaccine along with CDC and Wisconsin DHS. We encourage parents of children who are eligible to seek out vaccination for their kids. For those who are concerned, we would like to stress the safety of the vaccine for children. Before the EUA was approved for the Pfizer vaccine in children ages 5 to 11, there were extensive clinical trials conducted to test the safety and effectiveness of the vaccine in this age group. Additionally, COVID-19 vaccines are being continually monitored for safety with the most comprehensive and intense safety monitoring program in US history. I do really quickly want to touch on a few very rare adverse reactions that are frequently mentioned in tandem with COVID-19 vaccine misinformation, specifically myocarditis. Cases of myocarditis or inflammation of the heart muscle have been reported after receiving the Pfizer COVID-19 vaccine among children ages 12 to 17 years old. However, these reactions are very rare, with one study estimating only 54 cases of myocarditis per 1 million administered doses. The vast majority of those who experience myocarditis respond very well to care and feel better very quickly. We've also heard concerns about allergic reactions as well. A severe allergic reaction like anaphylaxis may happen after any vaccine, including the COVID-19 vaccines, but again, this is very rare. Despite circulating misinformation, there is no evidence that COVID-19 vaccines cause fertility problems, and people cannot get COVID-19 from getting vaccinated. In short, COVID-19 vaccines are very safe. Serious health events after COVID-19 vaccination is very rare. Widespread vaccination is a critical tool to help stop the pandemic, and the benefits of the COVID-19 vaccine outweigh any known or potential risks. And back to you, Seth.
Great, thank you, Michael. Now we will go to Katrina, who will be talking about community testing locations and vaccination clinics.
Thank you, Seth. With the 5 to 11-year-old age group becoming eligible for the vaccine, we are anticipating about a third of parents with children in this age group wanting to get their children vaccinated as soon as they are eligible. In Rock County, that translates into approximately 8,500 children. To facilitate a surge in demand, we are working with the AMI-hosted community vaccine clinic in Janesville, as well as hosting in-house vaccine clinics to ensure access is convenient for all who wish to be vaccinated. The AMI community-based vaccine clinic located at the former Rock County Job Center at 1900 Center Avenue in Janesville has started vaccinating 5 to 11-year-olds. The clinic's regular hours are Tuesdays from 11 a.m. to 5 p.m. and Thursdays from 11 a.m. to 3 p.m. AMI will also be offering extended hours this Saturday, November 13th, and Saturday, November 20th, from 11 a.m. to 3 p.m. People who are receiving the first dose of the 2-dose vaccine will be able to return to AMI on Saturday, December 4th, or December 11th for the second dose. While the extra hours are primarily to meet the surge given the new 5 to 11-year-old approval, vaccines will be available to anyone who is interested. The Pfizer, Moderna, and Johnson & Johnson vaccines are all available at AMI. There is no cost to participate and no documentation or insurance is required. Masks, however, are required. Children under 18 years of age require parental consent and should be accompanied by a parent or guardian for the vaccine clinic. Registration is available at vaccinate.wi.gov, and walk-ins are also welcome at the AMI community-based vaccine clinic. The Rock County Public Health Department will also be offering vaccinations for 5 to 11-year-olds beginning Wednesday, November 17th at our Janesville office located at 3328 US Highway 51. Clinic hours will be weekly on Wednesdays from 3 p.m. to 7 p.m., with the exception of November 24th and December 22nd. Walk-ins are also welcome. Appointments can be made by visiting rebrand.ly/RCPHD-COVID-APPT. The link is also available on the Rock County Public Health Department website at rebrand.ly/RCPHD-vaccine-info. We also want to announce that our partnership with Summit Labs is making testing more available in our Beloit Health Department office. Testing is available at that location Monday through Friday from 8 a.m. to 4 p.m. And I'll pass it back to you, Seth.
Thank you, Katrina. We will now open it up to questions from the media. We have one participant today, Austin Montgomery from the Beloit Daily News. We will give you the ability to mute and unmute yourself, and you can go ahead and ask any questions you have.
Hi guys, thanks for doing this once again. Just a few questions here. My first one here, do we have the total number of vaccinations that have been administered to that newest age group, those 5 to 11-year-olds? Just wanted to see if we had any initial data on that. I know we had that projected figure, but I wanted to see if there were any hard numbers that you could provide us for just how many had been given this week. Thank you.
Thanks for the question, Austin. We're currently waiting on the state data on the 5 to 11-year-olds. The last I checked, there were 6 in the system that had been counted that had been vaccinated in that 5 to 11-year-old age group, but that was at the beginning of the week. And the state should be providing us with data today or tomorrow, and we'll provide those updates on our vaccine dashboard in terms of how many kids in that age group are getting vaccinated. But right now, the data is a little bit limited, so more to come there.
All right, thanks, Nick. Now, just my next question. I know you guys had kind of touched on this already about how the size of the dosage had differed for 5 to 11-year-olds, but just wanted to see if you could kind of walk through the process of what, if any, the different steps might be for parents wondering about what the vaccination process is going to look like for their children. Thanks.
Thank you for the question, Austin. As far as the vaccination process, it'll likely look very similar to older age groups because there is still a second dose required for the younger population as well. So that second dose would be approximately 3 weeks after the first dose. It's just a smaller dose for the younger children.
Thank you. And then another question. I know with you guys ramping up demands here and kind of preparing for that, wanted to also ask about flu shot availability. Wasn't sure if the AMI site had offered flu shots or if the upcoming walk-in site at the health department was going to be offering flu shots, or if that's something that will continue to kind of just be available at pop-up locations. Just wanted to check on flu shots. Thank you.
Yeah, thank you for the question, Austin. It is definitely a great time to get vaccinated, both for COVID and for flu. And those vaccines can be administered on the same day, which is a great benefit to people who are interested in getting both. As far as flu shot availability, flu shots are widely available in Rock County through many pharmacies and healthcare systems. AMI is not providing flu vaccine along with their COVID vaccines. We did partner with some other vaccine providers to administer vaccine clinics that had both flu vaccine and COVID vaccine that was targeted at the kind of the younger child population before the 5 to 11-year-olds became eligible. We still have some of our flu vaccine that's specific for children available at the health department. So if that is still in need for people who are coming to our COVID vaccination clinics, we can look at administering that at the time as well.
Thanks. Just two more questions here. One for Nick. I know you mentioned kind of the possibility for an increase in hospitalizations, as we've just seen active number of cases rising and just a slight increase in the total number of new cases reported this week. Is there any concern about kind of heading into the Thanksgiving holiday with more people gathering for a possible increase in cases from where we are now? Just wanted to check in on that.
Yeah, it's definitely a possibility as we get into the holiday season and people are gathering and traveling and things like that. I think we saw some anecdotal evidence of case activity over the Halloween holiday where people were getting together. As we see case activity increase, it's always more of a risk that there could be more case activity when people are getting together. So it's important that people exercise caution when they're getting together with others and making sure that you're getting vaccinated and trying to distance as much as possible, wearing masks in settings that are very busy or there's lots of people present. So time will tell in terms of the case activity moving into the holidays, but it is definitely a concern. We can see elevated risk of spread during those time periods. So still just pushing people to consider getting vaccinated if you haven't gotten vaccinated and talk to your healthcare provider if you have questions about that vaccine.
Thanks, Nick. Just one more question here, guys. With the latest age group, the 5 to 11-year-olds getting approved, has the health department seen any increase in misinformation being shared or spread around? I know we kind of touched on some of the common threads that we've seen, but just wanted to see if there was kind of an increase now since there was a new age group who's now eligible. Just wanted to check on kind of what the health department is seeing locally in terms of misinformation. Thanks.
Thank you for the question, Austin. And I'll start, and others feel free to jump in as well. To my knowledge, we haven't necessarily seen an increase in misinformation being spread about vaccine. We often anticipate that when new people become eligible for vaccines or when there are new vaccines available, we kind of see an uptick in possible misinformation, before some of those questions can get answered. So in short, we haven't noticed any change with the younger age group becoming eligible, but it's something that we will continue to look at.
Thank you. I don't have any other questions, guys. Appreciate it.
Thank you, Austin. If there's no more questions, we will conclude today's briefing. These media briefings take place every other Thursday at 11 a.m. They are streamed on our Facebook page live, and the recordings are made available on our Facebook page and YouTube channel once the briefing has concluded. I want to thank everyone for your participation, and thank you to everyone who is watching via Facebook Live. If you are a member of the media and would like to participate in future media briefings, please send an email to media.publichealth@co.rock.wi.us, and we will provide you with the link to participate. Be safe and healthy, everyone. Thank you.